Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends. This is Monday, June the 20th. It's a pleasure to have you with us today. We're going to talk about a good oral health. And June is National Oral Health Month. Did I get that right?
Absolutely.
All right. And we have an expert with us today, Dr. Philip Batson from Columbia Healthy Smiles. Pleasure to have you here.
Thanks for having me, Paul.
You know, a lot of times people put off going to the dentist because they're afraid of the pain. They're afraid maybe they haven't been to the dentist for a long time and you're concerned about what they're going to find and what's going to happen. What are some of the first things that people need to consider in saying, I need to go to the dentist? I can't put it off any longer.
Yeah, sometimes, if they just know, if they truly know it's been a while since they've been, and, it's kind of like getting back in with your primary care physician, having that yearly physical or having just, blood tests run and diagnostic tests taken by your MD. Getting in to see a dentist and the dental office is the same thing. It's getting that update just on the status of your oral health.
Exactly. You take that first step. Now, see, I was guilty of that. For a long time, I was guilty of that. And then I guess it was about 35, 40 years ago, I went to see your dad, who was my dentist for years, for the first time. And you get that first one out of the way, and then you feel better about it. What are some of the questions, if you haven't been to a dentist for a long time, what's some of the most important questions that people need to ask?
I think a great question is just, what to expect on that first visit and, what's going to be done. And, what we do, we like to just get patients reestablished, or even if it's the first time they've ever been to an office, just get them established with what a checkup feels like and what records are taken, and we just try to talk with them and just show them everything. It doesn't have to feel like a daunting task or an overwhelming experience, because it's really an information gathering session,
right.
So that the patient can be informed of what's going on, and if there are areas of concern, just to then have a two-way conversation with their dentist about what are the ways that we can accomplish goals or get to health if there's some work that needs to be done, or maintain health if everything is okay.
Right. The overall health of gums, very important, right?
Absolutely. Gums are like the foundation for your teeth. It's your teeth are the nice big skyscrapers, but, without a good foundation of healthy gums and healthy bone, having a big skyscraper is going to fall over.
Right.
and
right.
I use that kind of in that analogy, but really healthy gums are so key to good oral health.
What do you look for to determine whether a person's gums are healthy or not?
So some of the things we look for, when they're in with us, we check measurements of their gums. So we check there's a pockets around all your teeth, a little space that we can take a little dental tooth ruler in and check the gum health. Different measurements there. We can also just look at the color of the gums. That tells us healthy or maybe if there's inflammation or it's a gum disease going on. We can look at it. Do they bleed easily? Do they bleed when you brush at home? Do they bleed when you floss at home? Are they really sensitive? All those things are indicators of gum health.
If your gums bleed when you brush or when you floss, is that normal, or is that something you should be concerned about?
It's something you should definitely be aware of and have a concern about. It's not necessarily normal. What it is an indicator of most of the times is that there's gum inflammation, irritation in that particular area, and that the gums just aren't quite as healthy maybe as they could be. because that bleeding is saying that there is inflammation, irritation, and that the bleeding is a response to potential bacterial infection in the area.
Doesn't it also matter what type of toothbrush you use? I used to always think that if you used a really hard toothbrush, that was going to get all that plaque off and everything. But that's not right, is it?
Not necessarily. We like soft bristle toothbrushes, and whether it's a manual toothbrush or an electric toothbrush, soft bristles are the best for the gums and the teeth. And that's because, as you said, plaque, you don't have to scrub really hard to get plaque off. Plaque is very soft and mushy. Gentle brushing can wipe away the plaque. The really hard, scrub brushing that people get into, that's really just being overly abrasive.
Okay,
to their,
I got
gums.
a question for you about that. Now, you say plaque is soft and can come off with brushing.
Mm-hmm.
I brush my teeth religiously 3 times a day, okay? But when I go to to have my teeth cleaned, always in the back, I mean the front teeth in the back, the lower one, have always got plaque. And I brush that and brush it. Why does the plaque build up there?
So what happens in that area, that has actually turned into tartar, or calculus is the term, and that's calcified plaque actually. So that area on most people is the area where they will collect and build up the calculus. And that just happens because it's an area where your spaces are tighter usually in that area. A lot of people have crowding there. A lot of people, plaque can get into the crevices real easily. Even with good brushing, can't get away 100% of it possibly. And it's bathed in saliva down there. You have a lot of salivary glands there, and then that helps adhere it to the teeth. And once it turns into that calculus, a toothbrush can't brush it away. And that's where the professional cleaning, when you come in with those, the hygienist has with those instruments, can get that calculus off. So it's not just you. It happens to almost everybody.
I know.
Yeah.
Mouthwash, we're almost out of time. Yeah. Is it good to use mouthwash or not?
Mouthwash is good. It does help. I tend to recommend patients stay away from alcohol-based mouthwashes. They dry the mouth out too much, and you don't want to kill all the bugs in your mouth, because we try to let people know there's good bacteria and bad bacteria in the mouth, and you don't want to wipe out all the good bacteria along with the bad bacteria. So alcohol-free ones are our preference, and any of them, if they have some fluoride in them too, I like those as well.
What about just we've got 20 seconds here. Just rinsing your mouth out with water instead of mouthwash.
That's rinsing your mouth out after each meal is beneficial, and can really help break up the sugars that are on the teeth, break up the food debris, and I think that can be very beneficial.
Okay. If you got any questions at all, first of all, don't be afraid to go to the dentist. It's not going to hurt. They're not going to hurt you. If you got any questions at all, give them a call. Where?
573-875-7071.
Okay, that's Dr. Phil Batson, Columbia Healthy Smiles. Always a pleasure to have you here.
Thank you, Paul. Appreciate it.
And tell your lovely wife, Elizabeth, we said aloha.
Absolutely. She's sorry she couldn't be here.
All right, we're out of time for today. Drop me an email, pepperp@missouri.edu. Have yourself a nice day. Bye-bye.